Hello, everyone. Good afternoon. My name is Michael Brotherton. I am the co-founder of Dragonfly 44 Capital. We help to connect strategic capital to companies within the neuroscience space. And then, confusingly, I'm also the co-founder of another project just called simply Dragonfly, where we're building a fully legal psychedelic retreat down in the Caribbean. I'm honored today to be able to speak on this stage with someone I truly respect, not only for his knowledge on chemistry, pharmacology, and science, but also for his value system and always remaining true to his message. I first met Hamilton 5 years ago during a cactus preservation fundraiser in New York. At the time, I was very nervous to approach him because I was a fan of his show, Hamilton's Pharmacopoeia. I'm still a fan. I subscribe to his podcast on Patreon. Suggest you guys all do the same. But now he's just a little bit easier for me to talk to. Please welcome to the stage Hamilton Morris.
Hey, everyone.
All right, Hamilton. So last night, me and Hamilton went to the microdosing collective party, and I saw a lot more fans with the same sort of mix of hesitation and excitement approach Hamilton and start up conversation. Each conversation, Hamilton was completely engaged. I was wondering, what was the most interesting question that you were asked last night and why?
Yeah, well, I think there's still fundamental questions about what remains to be discovered, which excites me, the unknown unknowns, because for the last maybe 15, 20 years, a lot of research has been oriented toward validation of things that we already kind of know, which is worth doing. I'm not trying to criticize that, but placing ideas like LSD being a treatment for alcoholism or psilocybin being a treatment for cigarette dependence or things like that on firm medical footing so that the next steps can be taken and these things can actually be implemented as therapies if they show that they actually exert these sorts of therapeutic effects. So I get it, but I'm also just curious to see what sorts of totally unanticipated things are going to be discovered. And I think that's a discussion that a lot of people are having. It's vague, sorry.
Yeah. I think we'll probably try to get into that a little bit more in the middle of this. We'll sort of take it back a little bit. I mean, I know that you're a lot of things. You're a documentarian, historian, podcaster, psychonaut, consultant, but really I think of you as a chemist. What is it about chemistry that you love? What excites you about chemistry?
Oh, yeah, I mean, there's something very timeless about chemistry, and this is, I think, one of the most wonderful things about what's happening at the moment is how many people are getting to really see the work that Alexander Shulgin did to resynthesize a lot of these compounds that up until recently, probably nobody other than Alexander Shulgin had ever even investigated. And I think there's something beautiful and low-tech about making these small modifications, examining how these small modifications impact the biological effect of a drug. And I know that people are very interested in AI and machine learning and mini brains and all sorts of sophisticated new technologies, but I think chemistry there's something beautiful and timeless about how little it's changed over the last 100 years, how a synthesis from 100 years ago still works today and is still as valid today as it was then. Something nice about that.
Yeah. There's something very, very elegant about that for sure. Back in January of 2022, the DEA announced its intent to place 5 tryptamines in Schedule 1 of the Controlled Substances Act. You personally took a lot of time, resources, and focus to talk to lawyers, testify, issue pretrial statements, and more. One of these tryptamines is DIPT. Can you give a bit of background on this story and then talk about why that particular molecule is so important to you?
Yeah. So for anyone that isn't aware, last year the DEA was attempting to prohibit 5 different tryptamines and 2 phenethylamine psychedelics, and thankfully they did not succeed, not just due to anything I did, but a lot of people working together, a lot of lawyers, Matt Zorn and John Hunter, and a lot of people were really, and Matt Baggett, tons of people were working together in a really inspiring way to prevent this from happening. And remarkably, we all succeeded, and the DEA withdrew their intention of prohibiting these substances, placing them in Schedule 1. And one of the compounds that they were considering prohibiting, DOI, is really important for scientific research. So it could have hobbled a lot of the current pharmacological investigations that are happening at universities across the country. It was a big deal that they were trying to do this. And I'm amazed that we succeeded, but I also think it's worth noting that they haven't stopped. They continue making drugs illegal. The difference is that they're drugs that people don't care about quite as much. And so maybe I'm a bit of a hypocrite in terms of not coming out against the prohibition of like a Ritalin variant, like ethylphenidate or something like that. But I honestly think that it's just as important. Every single time a drug is placed in Schedule 1, it represents a huge blow to scientific research and the future of medicine. It's so difficult to undo this once it's done that nobody has ever succeeded in moving a drug out of Schedule 1. Even with the President of the United States saying that cannabis should not be prohibited, that's not sufficient. So it's a really big deal when this happens, and I encourage everyone listening to this to go to the Federal Register website and keep tabs on what the government is doing. They have to announce their intention to place new drugs in Schedule 1, and you have a period where you can voice your objection or maybe your support, although I kind of doubt that there's many supporters here, you never know. But you can voice your objection, and you can call for a hearing. There's things that can be done. You don't have to just sit by and assume that the government has the ability to take away your freedom without any sorts of checks and balances. So just something to be aware of. And with DIPT, it was very important to me. I don't want to fall into a trap of saying it shouldn't have been prohibited because nobody was abusing it, because even if people were abusing it, it shouldn't have been prohibited. Prohibition is not a valid strategy for limiting the harms associated with some drug use, right? It's like if that were the case, then heroin would not be a problem, but it didn't work. So it's not, the point isn't even that nobody was abusing DIPT. The point is that this is just a insane strategy for any drug. But with DIPT, the absurdity of it was really highlighted because this is a substance that's very useful for scientific research that could play a huge role in the study of auditory perception and maybe other things as well. Preliminarily, we have some really interesting indications of other things that it could be doing. And to just make it illegal for the hell of it is an absolutely stupid thing to do.
Yeah, agreed, fully.
And it really is worth, I'll make an effort after this. I'm going to write a comment, but they're trying to make ammoneptine illegal now. This is, I imagine no one here is even familiar with that drug. This is a drug that no one uses, but maybe just as a sort of exercise, just object to that. Just try it out, see how it feels. It's, I assure you, it should not be illegal. It's the fact that no one here has heard of it should be an indication that this is not a threat to anybody's safety. Yeah.
Got it. Ammoneptine.
Yeah.
Okay. Are there any other drugs that are important standouts to you? Ones that you feel that have an important place in other developmental pathways, but ones that other people haven't been focusing on or maybe forgotten about?
Yeah, I mean, my friend Mike Cunningham, who was at the lab of Dalibor Samis at Columbia, he was doing research on a drug called Ariadne. Is anybody familiar with this drug? Any Ariadne enjoyers out there? No? Okay, apparently not. So, during Alexander Shulgin's career, he invented hundreds of drugs, but remarkably, none of them were ever seriously investigated for medical use during his lifetime, with maybe, you could argue that was starting to happen with MDMA toward the end of his life, but the one that actually made it close while he was alive was a drug called Ariadne. And there was a pharmaceutical company called Bristol Laboratories that took this through phase 2 clinical trials, and in their patent literature, they describe all sorts of miraculous effects, that it's a treatment for Parkinson's disease, for senile dementia, that it improves memory, and so on and so forth. And nobody knows exactly why it was never brought to market, and it has remained this very interesting pharmacological mystery. So my friend Mike Cunningham did the first 21st century investigation of Ariadne and published it a year ago. It's a really beautiful paper, and he found that it did exert this miraculous anti-Parkinson's effect in an animal model. And I think that's, the other side of this is I'm very excited about discovering these new things, but also just going back and trying to validate some of these lesser known things. Like obviously, LSD as a treatment for substance use disorder is worth doing, but this is something that was totally forgotten about that, could represent a really valuable medical treatment in the future. Yeah.
Yeah. All right. So I've been to quite a few psychedelic conferences, and I know Hamilton has too because I see him there. And some of these conferences, I think, are focused more consumer-based. I think maybe Wonderland kind of fits in that category. Other conferences are a little bit more research or drug development focused. I think there's a lot of different paths to provide more access to psychedelic drugs. And if we frame it in that light, just focused on access, how do you think the psychedelic space could effectively play out over the next 5 to 10 years?
Yeah, I think with access, the major hurdle is to recognize that no single path will satisfy everybody's needs. And if you assume that that is the case, everyone will be unsatisfied. So if you think that it has to be medical and only medical, that's going to leave a huge number of people out. And if you think that it has to be only non-medical, that's also going to leave a huge number of people out. And so I really think that, obviously the cannabis industry receives a lot of criticism, but what I see happening in New York, at least, represents a pretty good scenario where you have many different routes of access for different types of users. If you want a federally legal THC medication that you can use and travel across state lines, you have Marinol. It's approved by the FDA. If you want a state-sanctioned vape that's prescribed by a medical doctor and undergoes certain types of regulatory control, you can have that. And if you want to buy it at a dispensary for adult recreational use, you can do that. And if you want to grow it yourself or buy it from some guy on the street, you can do that too. And that is, I think, what freedom looks like, where people have the ability to choose whatever type of use and whatever network of distribution is best for them. I would like to see something like that with psychedelics, where these models don't exist in opposition to one another, where it's medical versus recreational versus spiritual versus whatever, but the ability to do whatever you want.
Yeah, agreed.
Yeah. Well, you're working on something.
Yes.
Yeah. What is your strategy?
Yeah, so I am working on a project in the Caribbean right now. The reason why this project is exciting to me is there's a country in the Caribbean that they want to develop a sort of wellness psychedelic tourism industry, and they've been working on the past couple years how to really figure that out. And we got one of the first licenses there, and having just a license, I think, is a really important step in the legal framework. It allows us to, work under international drug laws as long as it's attached to a research framework. But this is sort of just like step one. Step two is we've also been writing legislation alongside this country. And once they pass legislation, then we're going to have a framework that's fully legal under UNICP. So UNICP is sort of like the international drug laws and drug police. So there's places like Jamaica or Costa Rica that have they've decriminalized drugs or certain types of psychedelics, and you're able to use them, but you're still not legal under any type of international drug protocols. So why this project is so exciting to me is we're we're essentially creating like a DEA and an FDA that, as a stakeholder and license holder, we have a say in and get to develop alongside the government. And you know, we are definitely want to do it in a very safe way. Yeah, I mean, this is something I sort of wanted to touch on a bit. It's just the difference between, you know, approving a drug. Like, there's reasons why the FDA is so stringent, and I sort of get those reasons why the FDA is so stringent. But I do think there's a difference of approving a drug like a psychedelic, where there's a lot of people that have been using them, and we have a lot of first-hand trip reports over many years, compared to something like an Alzheimer's drug where people aren't really going to be testing it themselves. That being said, you can't really take those systems and checks and balance in place, and I think there's other reasons why they're in place too. I mean, we don't want to be buying drugs that really aren't effective, even if they are harmless. We want to be using them for effective reasons. So I get why it's in place in the U.S., but that's why these systems outside the U.S. I think are so interesting and intriguing, because they are granting us this flexibility to be able to develop off the knowledge that we already have, and create a new framework for psychedelics.
Yeah, I mean, this has been a fantasy for a long time. Didn't Timothy Leary have an idea of just let's start an island, and it'll just be the LSD Island, where we're allowed to make LSD and use LSD, and we can just abandon all these bureaucratic sources of interference and be free. I mean, I would like to see something like that on many levels. I'm also scientifically interested in that. I mean, obviously, there is like a little bit of a Jurassic Park / Island of Dr. Moreau concern that completely removing yourself from any regulatory bodies could promote some kind of maybe evil sci-fi scenarios. But at the same time, there's so many basic things that have become almost impossible to do scientifically due to the culture in the United States. Like, up until really the 1980s, you could publish human self-experiments with drugs in prominent scientific journals, and then that just became unbelievably taboo, to the point that it's basically never done. You couldn't publish an article in the journal Psychopharmacology the way Alexander Shulgin did, saying, I made this drug and I tried it and it had this miraculous effect. That would be considered also, in addition to dangerous and potentially unethical, it would also be considered unscientific, which I think is one of the greatest tragedies, because a human being trying a drug being unscientific, but if I were to, you know, inject it into a chinchilla and see how its head twitches, that would be scientific. That would be, everyone would agree, oh, that's really useful, thank you for doing that. Like, this is what science should be. So, like, obviously there are limitations and potential problems with human self-experimentation and using small numbers of people to evaluate any kind of medical phenomenon. But I think the idea that this is somehow radically worse than animal experimentation is very naive. And I would like to see a return to that sort of scientific freedom where people are able to publish the sort of work that Alexander Shulgin was publishing. I think it will really accelerate the pace of innovation. I think it will open up the sorts of experiments that people are doing. I think it would be a great thing. So I hope your island has maybe a scientific journal, a research facility.
Yeah, no, for sure. I fully agree, and I think it's interesting that this conference is both on, I think, longevity and psychedelics. I think these are the two fields where there is a lot of self-experimentation, and a lot of people want access to both of these modalities. And it's interesting that there's, you know, a similar interest level on both of these. I mean, I'm curious. This is something that I'm thinking about too. I mean, you mentioned in Shulgin and his own trip reports, and it's obviously coming from a reliable source and someone who knows chemistry and was developing these compounds. It's, you know, how do we keep that quality control in place while doing these experiments? And I guess you mentioned attached to research, and then there's certain, just curious your thoughts on that.
Yeah. Well, I mean, if it's coming out of an actual lab, there would be the, you know, accompanying analytical data to demonstrate that the compound in question had actually been made and was correctly identified. But more broadly, I think one chapter of the history of drug policy that's rarely discussed is what happened in New Zealand around 2014, where this former guitar teacher named Matt Bowden successfully campaigned to he initially just wanted cannabis to be legal, and they said, absolutely not, under no circumstances can that be done. And he said, well, what if I create a sort of pharmaceutical framework where I invent new drugs and demonstrate that they are safe for human consumption and sell them for recreational use? And they said, okay, yeah, you can do that. So he created these sorts of almost a pharmaceutical company for developing recreational drugs, sold them in New Zealand, and most people view this as a sort of failed experiment because they were synthetic cannabinoids and people developed problems with it. But I actually look to that as a really amazing achievement and something that sort of served as a precursor to a lot of what we're seeing today. I think the failing, if there was one, was not with the regulatory system, although, of course, cannabis should have just been made legal. That would have been the real solution. But it was a cultural problem where people were so unaccustomed to this sort of freedom, and they didn't have sufficient resources in place to help people contend with the problems of excess use. And of course, we often conflate problems that are associated with poverty with drug use when a lot of these things are interlinked in such a complicated way that there's a reason people like to blame drugs. It's much easier than describing these systemic failures that would lead a homeless person to smoke synthetic cannabinoids from a bodega. If you can blame the bodega cannabinoids, it's a lot easier than blaming a lack of mental health resources for homeless people in New York City or whatever. So a similar thing was happening in New Zealand. People reduced it to a basic drug problem the way they always do. And I think a lot of the valuable positive things that came out of that experiment were forgotten. I would love to see something like that in the United States where, it's already done with supplements to some extent, right? There's a little asterisk on the bottle and it says this is not approved to treat any disorder or whatever. So you take your GABA supplement and you understand that you're doing it at your own risk and it's not being prescribed for treatment of disease. I'd like to see that with synthetic drugs as well, where you establish that they are what they are supposed to be. You ideally do some basic toxicology work, and then you sell them as drugs with no pretense of medical use. I think that's actually kind of a good thing.
Yeah. No, I fully agree. Myself personally, some of the best drug experiences I've had have been with benzofurans that, if I go and ask people, and just kind of generally, if they've heard them, no one's heard of these compounds. And some of these have been the most impactful experiences of my life, and I know that they're safe, and really would like to be able to allow other people to experience things like this. Curious your thoughts on resources like Aoid and Reddit, and how we could use and integrate some of those existing trip reports into, maybe just minimum safety data for drug development, or how people can trust those resources.
Yeah, Aoid has been a invaluable resource since the 90s, and it's also sort of emblematic of how complicated these harm reduction efforts can be, because the DEA uses Aoid reports to justify prohibition. So when you actually looked at the documentation and their reasoning for the prohibition of these tryptamines, they were citing Aoid experience reports as evidence that these are drugs that are being abused. So the very work that was being done by the community to prevent harms associated with use was being used by the government to increase harms. And that is an unfortunate reality that we have to contend with. I think that Aoid and Reddit and these forums allowed people to publish these reports, and it was amazing and continues to be amazing. It's a lot better than nothing. But what I would love to see is something that is one step above that, where you have some kind of analytical validation of the drug in question, because if you see somebody saying, I took 6 APB, it was amazing, 300 milligrams is a good dose, who is that person? You don't know anything about them. Maybe they're gigantic. They could be a giant. that could be a completely unreasonable dose. They might take MDMA type compounds every weekend and you never take them. And you might, what is a normal dose for that person might be an insane overdose for you. Or maybe they don't even have 6 APV. How do they know? Do they have GCMS or NMR? Do they have any sort of analytical instruments? Are they even weighing it out? It's like if there's a drug that was very, very minorly popular in the early 2000s called 5-MeO-AMT, and there's a lot of negative experience reports on Aoid. And if you look, so many of these reports, people aren't even weighing out the dose. They're like, eyeballed about 7 milligrams, way too much. It's like, what do you mean you eyeballed 7 milligrams? Like, how do you know what that looks like? I wouldn't know what that looks like. So but this is like a reality. So even having those sorts of the most basic sorts of validation in place, similar to what Alexander Shulgin did. Yes, it's 1 or 2 people trying a compound. Yes, there's variation between individuals, but the compounds had been analyzed, their identity was certain, and the dose was certain. That much was certain. And you can use that sort of information and really help people. So I would like to see, I'd really like to see a new scientific journal that is focused on human bioassays, that introduces that type of validation. And I'm working with a friend, a chemist who I've worked with for years, Jitka Nikodimova, to try to make something like that happen.
Yeah. We would love to see the same thing and love to have something like that in place on the island. We have around 1.5 minutes left. I guess we would have time for one question. If anyone from the audience has a question.
Who's got a question? Okay, one question. One.
Hi, Hamilton. We know each other, but my name's Brian Pace.
Oh my
I'm
God.
with the.
You give the microphone to him of all the people in the audience.
So I'm with the Center for Psychedelic Drug Research and Education at the Ohio State University. I'm also the Politics and Ecology editor at Symposia. Last year, circumstances prevented me from seeing your talk, but I was surprised to find my work featured in it with a couple of slides. So I actually do have a question. I was wondering if perhaps my new paper might show up in your talk today, but if you'd like to talk a little bit about this is really my question, because I think that you don't understand the analysis that we put forth, and that either that or perhaps you misrepresented it. So I was wondering if you would be open to a conversation about this work and our more recent work. I would have asked you, but we've never interacted on Twitter, but I found that I was actually blocked before I could send you a message. So
is this a Church of Silence?
My question is, would you be open to a discussion about these things that you're clearly interested in? Thank you.
Yeah. No. I'll answer that. It was a fine question. Yes, I would love to talk about it. And to be clear, I don't disagree with the entirety of that paper that you published. I agree actually with the majority of it. I mean, a lot of it is objectively true. If you're describing the fact that psychedelic drug use has been associated with all sorts of bad behavior and right-wing behavior, I agree completely. That's objectively true. The argument that I had is with any type of pharmacological determinism in both directions, whether you're saying that psychedelic drug use promotes goodness and liberal values and ecological consciousness, or conservatism, authoritarianism, fascism, whatever. I think both directions of deterministic thinking are misguided, and that was what I was trying to critique.
Thank you. One last question.
I like discussion. I was kidding. It was a good question. I'm Megan. I live in Miami. I was a dietitian for 10 years, so I'm really into nutrition. And then I'm in medical school here in Miami as well. And I'm interested in psychedelics and bringing it into society like you guys are talking about. And I guess my question is more broad-based, but do you have any advice for how the medical community, like you're talking about freedom on these multi-tiers, and do you have any advice on how the medical community tier, like people like me who are interested in psychedelics, who are going to be doctors, what we can do to kind of bridge the gap? Because I can't even say ketamine in my class without my peers going, "Oh my God, she's talking about drugs."
Really?
Yeah,
I mean, it's
and then
an FDA-approved treatment.
I'm just being like truthful
Doctors definitely
about the medical community, and God, I hate to bleed my medical school and say, but that's what people are doing in the academia world. And then you have people who are in their early 20s that don't want to talk about it because they're scared because they're quote drugs. And then even the people in their 70-year-olds, older people that are my research facilitator didn't let me study ketamine, and I had to get special approval to do it. So there's a lot of people in academia that are scared to talk about psychedelics. And I don't know if you have any advice for how to bridge that or how to tread.
Yeah, I mean, I do have advice, but the advice I find annoying, which is one of the reasons that Michael Pollan's book was so successful is that it really plays into these conventional politics of respectability. You say, well, I don't know about these psychedelic drugs. My own experiences were unclear to me. But then when I saw some medical doctors at Harvard University saying that they were good, it was the science that convinced me. And then you say that these medical doctors have never used the drugs themselves, right? You introduce that lie because if they had used the drugs, that would somehow contaminate their objectivity. So you pretend that nobody has used the drugs and you emphasize their academic credentials and you talk endlessly about how medically validated it all is. And that seems to work very well rhetorically. As a rhetorical strategy for convincing people that it's okay to use psychedelic drugs, it clearly works really well. I don't think that's a good strategy. I find it annoying. I think that you shouldn't have to have this sort of medical pretense to consider the psychedelic experience valid, that you don't need to make it anything more than enjoyable. It doesn't need to be a treatment for a disease. It doesn't need to be a transcendent spiritual experience. It can be anything you want it to be. But if you're trying to convince people, that Michael Pollan strategy clearly works very well. So copy that, I guess.